Hi, this is Cheryl, and this is a movement study that's really looking at the relationships between the release of your low abdomen and often the release of your low back that comes with that kind of release, and being able to move your legs in your hip joints in a way that often is called like windshield wiper legs. But I want to focus on this movement study to do it in a way that's really minimalist and helps set up a taste for the kind of degrees of freedom that can happen moving your legs in your hip joints with a release of the tension in your low abdomen, on the inside of your legs, on the outside of your legs. Because often we have all kinds of patterns of holding, holding up tension in our low belly, holding up tension in our low back, the IT band, the outside of our hips and thighs. I think most of us hold some kind of pattern of holding that means we don't experience the kind of freedom we can have in moving our legs more freely in the hip socket as if we were just skeletons. And so I'm going to demonstrate a little bit, what this kind of movement study can look like, and a few things to highlight, for consideration as you explore for yourself. So the first one I want to talk about a little bit is some of us have a natural arch or a habit of holding in our low back. And so when we talk about the idea of, if this is holding my low abdomen tightly and then I release, when we're lying and when we're sitting, that can lead us to put a natural arch in our low back. And so we kind of can trade tension from here and then create tension in the back. And so to just explore this sense of in releasing, and I like to think about like lengthening the distance between my belly button and pubic bone, that in doing this movement, I can change this length by literally rolling over my own pelvis. So I'm creating an arch by releasing my belly. But a way that's quite interesting to work with is to, if possible, leaving your low back with some kind of degree of contact with the surface below you, and then just releasing the muscles and sort of that lengthening down towards your pubic bone from your belly button without doing the lift. So it's like, the tissues on the top release, and there's the possibility of them to kind of lengthen down, towards the legs into the groin area. And so that's something to play with that can be done with breath. So the idea of, filling up and increasing this area and then releasing down. But it also can just happen as a kind of mechanical, I'm tightening and then I change that and reverse that down without this large, pelvic tilt here that creates the arch in your low back. So I wanted to mention that because it's one of those differences that can really make a difference. And so that may be a piece just to work with. I mean, you can do that in sitting, doing it lying on the ground gives you a sense. You can have your hands here just to kind of register that this kind of release can happen, whenever you put your attention to it. And so it's a way to begin to work with, once you found a way to release this tension, that you could just come back to that. And so this is sort of like a part one of this. But what I'd like to explore, and I want to offer sort of some contrasts, is that the way our legs are, so having your knees bent, your feet on the ground, we have a lever here from the knee into our hip joint. And so there's a possibility, given how that round, the ball on the top of the femur fits into our hip joint, that our legs have this possibility to freely rotate one way and the other. And for most people, there's some kind of pattern of holding on either side of the leg, in the low back, in the abdomen and the groins, that this freedom, this movement comes with work, with some kind of tension. And so it's helpful to kind of, through contrast, explore what I would call a very minimal range of movement. So however far you can go, and have a sense that, in fact, your legs just move freely, as if they're a skeletal leg. And so that may be a centimeter or two, it might be 3 or 4, but just to, get a feeling of that movement, and then pairing it with a couple of conditions to contrast. And so one would be, tightening your abdomen up, lifting it up, and then exploring how it's possible to move your legs. And so your pattern may be different. I'm noticing I have a lot more tension in my upper inner leg muscles, the abductor muscles, and definitely more on the top of the quads, so that there's some movement, but there's also some real barriers I'd have to get through in order to move. And I immediately feel that pulling on my low back. And then the other, the second option would be this release of the belly. So you're releasing your low ab, but in a way that pops up the arch of your low back. And again, to explore how that's possible. So again, you may notice certain things. I notice a sharp and extreme kind of pain on the inner hamstring on the back of the leg, and some of the connecting muscles around my knees are really triggered by that. So movement's possible, but there's some work that happens with this. And so contrasting, then leaving your low back against the ground, having this release happen without that pelvic tilt, and then exploring what this movement can be. And so just contrasting for yourself how you're dealing with the tension or the release of tension in your low abdomen, the position of your pelvis such that it either creates an arch in your low back or allows your low back to be a little bit flatter. And then this release of your abdomen, so that you can explore, the beginning of that possibility that your legs could just move back and forth in the hip socket. And so again, do this seeking the sensation of which options, where you feel the work, what feels more free. Stay within a range of motion that feels comfortable and possible. You don't need to do some kind of fulsome movement to really explore this sense of degrees of freedom. And the other thing I would say is, don't get overly caught up in your breathing pattern to support this. And in fact, you can kind of ignore your breath a little bit and just, play with this kind of mechanical release, and then exploration of the movement. And later, if you're curious, you could bring attention into your breath to explore this. But that's another layer that could be kept for a later time. And so hopefully you find that to be an interesting, pieces of elements, factors that help you explore the relationship of how your legs can move, the kind of patterns of holding or releasing tension in your low ab and your low back, and how those relate to how it's possible to move your legs. Part of the goal and the interest in this kind of movement study is to help your body reassociate with a more balanced use of muscles on the outside of your leg, and the inside of your leg, on the top of your leg, and on your hamstrings at the bottom, because all of those patterns of holding have direct implications for the joints. So for your knees, for your ankles, and for your hips, in terms of how easily they can move, and whether, some muscles get overused and become painful when you're doing very basic activities like walking or squatting or going upstairs. Those kind of imbalances can really pull on and create the discomfort or pain related to, where these muscles and tendons attach at each joint. So, enjoy that exploration. Happy to hear from you if you have questions or things that you'd like to chat more about. And take care. Have a good day.